Good morning, everyone. This is Rebecca Strauss with Miller Johnson. I'm joined today by my colleagues, Marcus Campbell and Sandy Andre, to talk to you about all of the employment law related aspects of the American Rescue Plan and also the updated CDC guidance for vaccinated persons. Both of those items were breaking news last week. Thank you so much for joining us today, as every day, but also since today is the first day after the time change, an 8 o'clock webinar on Monday morning. You are extraordinarily dedicated if you are here this morning after the time change. So good morning. The sun just rose where I am sitting, and let's get started. First up, today's topics, again, the American Rescue Plan Act of 2021. That is that very large piece of legislation that President Biden signed on Thursday. We're going to talk about two aspects of this plan, the Ffcra and unemployment. I'm also going to mention one other aspect that was added at the last minute, which has to do with grants to pay frontline workers. So that was a last minute Senate amendment. Not a lot of details on it yet, but I do want to make you aware of it. And then we are going to talk about CDC guidance for vaccinated persons. Next slide, please. Next slide, please. Okay, let's talk about first, just real quick, extra pay for workers at essential businesses. As I mentioned, this was a last minute Senate amendment. It hasn't gotten a lot of press yet, but I expect you'll be hearing about it in the next few months. The legislation allocates money for workers performing essential work during the COVID-19 health emergency by providing premium pay to eligible workers, to state and local employers, that should read, and also by providing grants to eligible employers that have eligible workers who perform essential work. Okay, that sounds like I'm talking in circles, right? I just report the stuff. I don't write it. The state will determine who qualifies as eligible workers. Under the statute, it has to include those workers needed to maintain continuity of operations of essential critical infrastructure sectors and additional sectors as each governor of a state may designate as critical to protect the health and well-being of the residents of their state. So there's some work to be done at the state level here to determine who the employers are and who the employees are, who will qualify, but look at the huge amount of money available, potentially up to $13 an hour in addition to the employee's other pay. So this is a $13 an hour bump with a $25,000 cap per employee. So potentially, if you are in one of the sectors that the governor will designate here and some of your employees qualify, this could be a significant amount of money for your employees. We expect, again, lots more to be done at the state level and also the federal level in terms of regulations, putting some more meat on the bone here. So stay tuned for that. Next slide, please. Now, what many of you have tuned in for, the Ffcra. Let's talk about how it passed in its final version. It was tweaked a bit from the House version, which is the last time I talked to you. First of all, importantly, the tax credits are now extended until September 30th, 2021. So this is an extension of the current scheme, right? If you remember, mandatory leave expired at the end of last year. But if you are offering paid leave to employees and that paid leave would have qualified for Ffcra, if Ffcra had not expired, then you could take that tax credit, right, for the wages that you paid that was set to expire at the end of this month. It has now been extended till September 30th, 2021. The total emergency family leave extended at credit per employee has increased from 10,000 to 12,000, and you'll see on the next slide why. That's because the first 2 weeks of emergency family medical leave act can now be paid. Okay, before the first 2 weeks, as you remember, was unpaid. Now the first 2 weeks can be paid. So the total credit per employee was increased. There is a non-discrimination clause added. So to be eligible for the tax credit, when you are offering this paid leave and paying it to your employees, you cannot discriminate amongst your employees in favor of their full-time status, their seniority with you, or their status as highly compensated individuals. Okay, so if you remember back when we talked about this shortly after the Ffcra expired, we said that because leave is no longer mandatory, you can offer it or not, or you can offer it in part, right? You don't have to follow all of the rules of the Ffcra in terms of who you offer to or how much of it you offer. So this is putting some guide rails on it. There are now some limits. There are new qualifying reasons for Ffcra. Under the Emergency Paid Sick Leave Act, you can now qualify for tax credits if your employee takes leave for receiving the vaccine, or if they cannot work because of the effects of receiving the vaccine. Some individuals, we don't know how many, or at least I don't know how many, have side effects significant enough that they can't work for about a day. So that would now be a qualifying reason for emergency paid sick leave, the time they have to take off to receive the vaccine and also recovering from any effects of receiving the vaccine. Another new reason, this was added by Senate amendment at the last minute, seeking or awaiting the results of a COVID test or diagnosis after the employee has been exposed to COVID, or the employer requested the test or diagnosis. All of the reasons under emergency paid sick leave are now also reasons for expanded FMLA. That is a big change. So lots more reasons now you could qualify for expanded FMLA. Next slide, please. Another big change, if you're a public body, public bodies are no longer excluded from the tax credit provision. Okay, what does that mean? Under the original Ffcra, there was a paragraph that said, I'm not reading it, I don't have it in front of me, obviously, but said these tax credits not available for the federal government employees, state government employees, or any subdivision of the state's employees. Okay, so that is why public employers could not take advantage of the tax credit. That paragraph was deleted. And in its place, it just says federal employees are not entitled to the tax credit. Obviously, that's just the federal employer, and they are, it would just be very circular if they could take the tax credit since they get paid by taxes. So if you are a state or local employer, you can now take advantage of the tax credit. There is also, importantly, as of April 1st, a reset of the 10-day Emergency Paid Sick Leave Act credit. So if you remember, there's a 10-day bucket for that type of leave. But now that we're extending the tax credits all the way through September, and it's now including vaccines as well, Congress re-upped that 10-day bucket beginning April 1st. And then again, remember, for expanded FMLA, now under the new law, the first 2 weeks are no longer unpaid. So you can now pay your employees paid sick leave for those first 2 weeks and get a tax credit for that. So that's a significant change as well. How does that interact with paid sick leave? Because if you remember before, the first 2 weeks of expanded FMLA were unpaid, but the reasons for expanded FMLA were also covered by paid sick leave, right? So they get their paid sick leave for the first 2 weeks, and then it would switch to expanded FMLA. How the two interact now that the first 2 weeks of expanded FMLA are paid, is still a bit fuzzy. We're expecting some guidance from the Department of Labor on that, or from the IRS on that. So stay tuned. My guess as I sit here this morning is that now folks could get a total of 14 weeks of paid leave that you could now get a tax credit for. But again, stay tuned for some more guidance on that aspect of the Ffcra. So that's what I have for you on Ffcra changes in the new law. I'm going to turn things over now to my partner, Marcus Campbell, who's going to talk to you about how the American Rescue Plan Act changes unemployment benefits. Marcus?
We're going to talk a little bit about the unemployment changes that were included in the American Rescue Plan. Generally speaking, there are three types of changes to the unemployment laws from the ARP. One, the amount of weekly benefits has changed, which it has done multiple times over the last year. The duration of benefits, how long you can collect them, that has also changed. And an important one, the taxability of benefits for tax year 2020, that has also changed. So if I could get the next slide, please. So if you look at how unemployment has gone since last year, very early on, once COVID hit, we had the CARES Act. That provided an additional 600 weeks. Now, the state unemployment weekly benefit amount has never changed. That's still $362. But until July 25th, 2020, we had the additional 600 weeks from the CARES Act. Then after that expired, we had a presidential executive order that provided an additional $300 per week in benefits. That expired December 27, 2020. Then after that, the Continued Assistance Act was passed, which provided an additional $300 per week. And now under the American Rescue Plan, that also has provided an additional $300 per week. So through Labor Day of this year, your laid off workers will be able to receive $662 per week. That's a combination of state unemployment plus the additional $300 a week from the rescue plan. Now, they should not have to do anything else to qualify for this additional money. They should be able to collect that through the unemployment agency. They certify for benefits, and that money will be automatically paid out. We have not heard from the UIA yet exactly how they were going to process these. My best guess is they're going to process these claims just like they did the other federal benefits in the past. So your laid off workers will not have to do anything except simply certify for benefits, and then that money will be paid to them. Can I get the next slide, please? All right, let's talk about the duration of benefits. So we talked about how much it'll get. It'll be a total of $662 a week. How long will they receive that? Now, an individual unemployment claim can last up to 79 weeks or until September 6, 2021. So these additional benefits that are paid out through the different federal unemployment system benefits are going to last for 79 total weeks based on when your original claim was filed, or they will last until September 6th, Labor Day, whatever comes first. So it's up to 79 total weeks of unemployment. That's for the people who are receiving pandemic emergency unemployment compensation. Those are the individuals who normally would qualify for 26 weeks of state unemployment. Plus, on top of that, they're getting an additional 53 weeks of PEUC for a total of 79 weeks. This also applies to individuals receiving pandemic unemployment assistance, the individuals who normally don't qualify for normal state unemployment benefits. The PUA is going to also last for 79 weeks or until September 6th. So for most Michigan claimants under the American Rescue Plan, they will be able to receive up to $662 a week in unemployment benefits up through Labor Day. Now, there were some extensions that were in place due to the high unemployment rate in Michigan. Those extensions have now ended. The unemployment rate has dropped to the point where extended benefits are no longer being paid out in Michigan. But that's not going to have an impact on the total of 79 weeks. Those can still be collected. All right, now this is a major change, something that we haven't seen before. Unemployment benefits for 2020 are no longer taxable. The first $10,200 in unemployment benefits are tax-free. Normally, unemployment benefits are taxed just like regular income. Claimants always have the option of having taxes withheld from their claim automatically by the UIA, or they can choose to not have taxes withheld and then pay that at the end of the year when they file their tax returns. Well, under the American Rescue Plan, the first 10,200 in unemployment benefits are now tax-free. Now, those benefits must have been received in 2020, and you must have a household adjusted gross income of less than 150,000. If you meet both of those criteria, then the first 10,200 in benefits that you receive will be tax-free. So that, of course, begs the question, what if I already filed my 2020 tax return? How is it going to work? What's the IRS going to do? Well, the answer is, I don't know. I don't think the IRS even knows now. Is it possible that they could go back and amend your tax return for you and simply return the additional tax revenue to you? That's possible. That's probably unlikely. What you will probably likely have to do is file an amended tax return where you take that money out of your taxable income, and you'll end up getting another refund from the IRS. But still, we haven't heard from the IRS, and we do not know exactly how they're going to handle it. But an educated guess is we'll probably have to file an amended tax return in order to collect that money. All right. Now, there's a couple of issues. These really have nothing to do with the American Rescue Plan, but I wanted to raise them just so that all of the employers out there are aware. Fraud is still a big problem in the unemployment system. If you could, I recommend that you keep an eye on your monetary determination forms. Those are the UIA 1575 forms. If you see those, take maybe one day a week and review those. If you're seeing those for people who are not your employees or for employees that are actually back to work and working, make sure you report that fraud. Discuss it with the employee. Don't immediately assume that somehow they're fraudulently trying to collect unemployment benefits. I have seen so much of this over the last year, just massive amounts of fraud in the system. So keep an eye on those monetary determinations. And if something doesn't look right, then you definitely should report the fraud online through your MIWAM account or through their online reporting systems. I also recommend that you periodically review your weekly charge statements. Those are your UIA 1136 forms. A lot of times you don't really see those forms. Perhaps your payroll provider uses those, or maybe they go to your finance department, or perhaps to your accountant. If you can manage to take a look at your UIA 1136, maybe on a weekly or bi-weekly basis, look at those and see what you're actually being charged and for what claimants on your account. That's another good way to identify fraudulent claims, because sometimes you don't even get a copy of a monetary determination. You don't even know that that claim is being paid out, but it will show up on your 1136 forms. So if you can, those all can be accessed on your MIWAM account. Take a look at those every week or two and say, okay, does all of this look legitimate? Is there anybody on here that should not be receiving unemployment? If you identify somebody, make sure that you report that fraud immediately online, and you can also do that through your MIWAM account. But online is the best way to report that type of fraud. The mail, with respect to the UIA, is still very unreliable. Faxing things still does work. The faxes are actually getting through now, but I don't know how quickly they're processing anything that they receive via fax. So it's best to do that online or through your MIWAM account if possible. Another issue, communication. It's still very poor. I spoke with a number of employers over the last year where they can't get a single response from the unemployment agency. And I guess I should say things are getting a little bit better, but they're still pretty bad. They're starting to improve, but as I say here on the slide, don't get your hopes up. They're still pretty bad, but things are actually starting to get processed now. And the secret is, if you can communicate online through your MIWAM account with the agency, that is the best possible way to do it. They seem to be more responsive to things that they receive electronically through that account. So that is the best possible way. So things are getting better, but the communication between the UIA and its employer customers is still very, very poor. And with that, I think I will turn it over to Sandy Andre. Can I get the next slide, please?
Well, good morning, everybody. Thanks, Mark. Thanks, Rebecca. And I am going to briefly cover with you this morning some updated issued CDC guidance specifically related to what fully vaccinated persons can and can't do. Next slide, please. So if you are like me and trying to track what is new at the CDC, this has become a full-time job. Just since we last spoke last Monday, they have made over 100 updates to their COVID-19 related sites. Some of those updates are going to be things that are directly applicable to this audience, and some are not, right? Some are just statistics related to COVID-19 and the vaccine, but some are substantive as it relates to all of us with our employer hats on. And one of those substantive updates, like I said, was interim public health recommendations for fully vaccinated people, and we'll go through those. But let's go ahead and start with a definition. What they mean at this point as fully vaccinated, they mean greater than 2 weeks after an individual has received the second dose. If they are an individual who's taking the 2-dose vaccine series, so the Pfizer vaccine or the Moderna vaccine, or they are 2 weeks post-vaccine if they're receiving the single-dose vaccine. So right now that's the Johnson & Johnson vaccine. So when we're talking about fully vaccinated people, that's what we're talking about, 2 weeks post whatever that last shot is, okay? Next slide, please. So the list is exciting things here. Some of us have been waiting for some of this for a very long time. So fully vaccinated folks can visit with other fully vaccinated people indoors without wearing masks or physical distancing. Okay, they can visit with unvaccinated people from a single household who are at low risk for severe COVID-19 disease indoors without wearing a mask or distancing. And they can refrain from quarantine and testing following a known exposure if they are asymptomatic. So that is fantastic, right? All of us with our employer hats on, that when we have a positive case in the workplace and we're engaging in some contact tracing and we're trying to determine who needs to be sent home, who needs to be subject to quarantine. And here in Michigan, of course, we have the COVID-19 Employment Rights Act, which we may all remember being called Public Act 238 at one time. But now, right, folks who are fully vaccinated, so 2 weeks post their second shot, their last shot in their vaccine series, they are not subject to quarantine if they are an asymptomatic close contact. So that's fantastic news. Next slide, please. And the list goes on. Fully vaccinated folks must continue to take precautions in public, like wearing a well-fitted mask and social distancing, right? So some of the things that they could do that's specifically related to social engagements or social gatherings, more private social gatherings, right? Residential. They should continue to wear masks, practice physical distancing, and adhere to other prevention measures when visiting with unvaccinated people who are at increased risk for severe COVID-19 or who have unvaccinated household members who is at increased risk for severe COVID-19 disease. They should wear masks and maintain physical distance and practice prevention of other measures when visiting with unvaccinated people from multiple households. Should continue to avoid medium and large size gatherings in person, should get tested if they're experiencing COVID-19 symptoms, right? So the vaccine, obviously, we're still learning so much. And so once you are fully vaccinated, certainly if you start to experience COVID symptoms, you should still continue to go ahead and get tested, reach out to your healthcare provider. Follow guidance issued by individual employers. As an employment attorney, I was super excited that the CDC remembered to put that in there because, of course, you as the employer, you get to decide in your own workplace to some extent, right? That if you want to have more strict requirements than what the CDC guidance is, or any other agency related to COVID, if you want to have more strict rules regarding those things, generally you get to decide those things. So I was very happy that the CDC took the opportunity to remind folks that their employers may have additional rules and they should follow those. Good news. And follow the CDC and health department travel requirements and recommendations. So next slide, please. So I hate to be the bearer of bad news, right? We started on such a high note here of all the good news that the CDC brought us this week. But again, with your employer hats on, I always want to make sure we take a pause and remember that the CDC guidelines aren't necessarily kind of the keys to the kingdom here, right? We have other agencies that have spoken on COVID-19 mitigation requirements, and we need to make sure, to the extent that those agencies, the direction that they're giving is more strict than what the CDC is now saying, we understand how those pieces work together. So the first place to start are state health department restrictions, state and local health department restrictions, quite frankly. So here in Michigan, of course, that's the Michigan Department of Health and Human Services. And here in Michigan, our most updated mask and gathering order, for example, was issued on March 5th, 2021. And all of those are still in place. There is certainly some interplay in that order and the CDC, right? There's several places in that order that talk about CDC recommendations. But to the extent, for example, when they talk about masks in public places and things like that, there's, excuse me, there's no carve out right now in that order for vaccination status, right? So those are still the rules of the road. And certainly local public health departments still do have a number of restrictions. Generally, those are more capacity restrictions, not necessarily what we're talking about here with the CDC, but it's really important that wherever you're sitting or wherever your employees are sitting, you recognize what those agencies have said and understand the interaction. The second piece, you know, I always like to talk about this, right? The occupational safety and health restrictions that may be applicable to your workforce. So here in Michigan, we have a MIOSHA COVID-19 emergency rule that is in place until at least April. I've got my trusty copy right here. That's in place until at least April 14th, right? It went into effect October 14th. It's in effect for at least 6 months. And so we know that we have those requirements. And there are masking and social distancing requirements there, and with generally no carve out for vaccination status of individuals. And so it's important to recognize those. For those not covered by the MIOSHA rule, there are a number of other states that have implemented COVID-19 emergency rules or even permanent rules across the country. And we know that the federal government, federal OSHA, is starting to move a little bit excuse me, as it relates to COVID-19. Just last week, they announced a national emphasis program. Here in Michigan, we might be used to that being called a state emphasis program, right? MIOSHA has had a number of those with respect to COVID. They had a hospital SCP, an office work environment SCP, manufacturing, retail stores, all of those pieces. And so the federal government has announced a national emphasis program that generally looks like it is focused on workplaces where employees have had a high frequency of close contact infection, right? So they're focusing on those things and what mitigation strategies they are. And so for those here in Michigan, we're not necessarily subject to that, but it's important for us to recognize that federal OSHA is starting to move on some things too, and recognize that we need to continue to keep an eye on that. And then, of course, as I mentioned in the slide before, specifically as it relates to the isolation and quarantine requirements related to asymptomatic close contacts, if you're a fully vaccinated individual, that you're no longer subject to quarantine. And the good news here is that here in Michigan, we have the COVID-19 Employment Rights Act, or PA 238, and the amendments to PA 238, the way that those are written, borrow the most updated CDC guidelines. And so in different days, we might have been pulling our hair out about that fact and going, oh my gosh, how am I going to track all this? This is such a, this is so difficult to do, but here it's a nugget. It's a nugget of really good news. And so it's even more important, right, for you with your employment hat on, to remember that you absolutely can request information or vaccine status from your employees, right? We've been talking about that in previous webinars, and this is a perfect example of why it's really important for us to know who really is fully vaccinated and all of those pieces, okay? And with that, I'll turn it back over to Rebecca.
Thank you, Sandy. Before you go, don't turn off your camera and microphone yet. I've got a few FFCRA questions, but one I know that you'll be happy to answer. One of our attendees would like to know when the MIOSHA rules expire.
Well, if I had a crystal ball, so the kind of a short and long answer, when those were implemented, remember, they could be in effect for 6 months, but they could also be extended for an additional 6 months. So our 6-month time clock is, the 6-month date is April 14th. Right. So I expect that we will hear something by April 14th, right? Whether it's from MIOSHA saying, yep, those are going to go ahead and sunset. Quite frankly, I would be shocked if that's the fact, if they were sunset wholesale, or we're going to extend them for a period of time. And these are the things that'll be different, or we're going to extend them 6 more months and nothing is going to be different, right? Those are kind of the options on the table. But April 14th is the first date that we're watching pretty closely. But remember, right, that remote work requirement lives in the MIOSHA rule, not the MDHHS orders. And I know, I feel like I say this bad news every single time and people get really upset with me. It's not the Sandy Andre COVID-19 emergency rule, guys. But remember, right, that remote work requirement lives in the MIOSHA order. And so that's the piece that we're watching really closely, because we think that that's kind of the next piece to maybe relax, or maybe I'm just saying it out loud because I'm hoping to speak it into existence. I'm not sure.
So mid-April, everyone should relax over spring break and come back ready for a whole new regimen of workplace safety rules, right? I'm going to just answer a few of the FFCRA questions. When do the revisions go into effect? So the federal law is effective as of the day President Biden signed it. So that is last Thursday. There are certain sections of the law that have specific dates attached to them, though. So for instance, the re-upping of the emergency paid sick leave bucket, right? That has a re-update of April 1st. The others do not have specific dates attached to them. Another question, do we have to offer the extension of FFCRA after March 31st if we have offered it up to that point? The answer is no, right? It's all voluntary. Ever since January 1st of this year, FFCRA has not been mandated, but it has been considered a benefit to employers that if you do pay, right, if you do pay wages for reasons that would qualify for the FFCRA, you can take a tax credit, but nothing is mandatory. And therefore, even if you have offered paid leave through 3/31, there's no reason why you have to extend it. Excuse my hand, I'm using my iPad today. So this is how I scroll through questions. Does the FFCRA reset on April 1st for employees who have already used for employees who have already used all the FFCRA pay allowed? The only amount that resets is the emergency paid sick leave. So that's that 10 days, right? Sometimes also referred to as 80 hours. That is the bucket that resets. So it's important to remember under FFCRA that there are actually 2 types of paid leave, right? The FFCRA consists of the paid leave sections. There's 2 sections. One is expanded FMLA and one is paid sick leave. The paid sick leave bucket refills, if you will, April 1st. There is no similar provision for the Emergency Family Medical Leave Act. Can you offer only 40 hours of FFCRA, and I'm assuming you mean emergency paid sick leave, rather than the 80 hours? Sure. None of it's mandatory anymore. So you can offer no paid sick leave, a little bit of paid sick leave, or the full amount that the FFCRA provides, and take a tax credit for whatever you offer, so long as the paid time off would have qualified for FFCRA. Sandy's head is about to explode. When I say you can offer no paid sick leave, I am only talking about FFCRA. Remember, in Michigan, right, there's Michigan Paid Medical Leave Act, and you'll want to check into whether there's any other provisions that require paid sick leave. So I'm just talking about the FFCRA, Sandy. I can see you still on. video, I knew what was going on in there. Is the 80-hour bucket reset mandatory, or is that up to the company? It's up to the company, again, for Ffcra, that 80 hours, it's all voluntary at this point. Nothing is mandatory. One last question, then we can answer others by email after the webinar, or you can call or email Sandy Marcus or I with other questions too. Sandy mentioned this briefly, but we've gotten this question so many times over the past few weeks. I'm going to ask and answer it again. I typed in, can we as an employer ask for vaccination proof? The answer is yes. There is yes. Okay, so let that sink in for a moment. Many of us accustomed to the ADA pre-COVID feel a little uncomfortable, right, with how much discretion we have. The EOC has asked and answered this question. Asking whether you've been vaccinated is not a disability-related question. Therefore, the ADA does not hamper your ability to ask for that. And employers are asking, first of all, because the quarantine period is different, as Sandy mentioned, right, for vaccinated individuals and others. So your obligations as an employer under the COVID Employment Rights Act is different based on whether your employee has been vaccinated or not. Also, many of you are considering vaccination incentive programs, right? So you can ask for proof in connection with those programs. So those are the questions. I think for me, there may be one or two more that have come in that I'll answer by email. Sandy, Marcus, any other questions for you that you would like to answer right now?
I don't see anything in the chat for me.
No, I'm all set.
Awesome. Okay, then we will sign off. Thank you all so much for coming on this early Monday morning. We hope you have a great rest of your day. Bye-bye.